I'll take you through the assessment approach to a patient presenting with anxiety symptoms. The first question, of course, is this presentation anxiety? Are there symptoms where the person's worried? Is there apprehension? Are they having inappropriate fears? As we know with anxiety, it's really catastrophisation of the future. Physical symptoms, pounding heart, shortness of breath, dizziness, trembling, butterflies in the stomach, etc. Then we've got to think about other disorders, other differential diagnoses, and make an appropriate referral. At this point, it's really important to rule out medical conditions because we know that certain forms of arrhythmias, for example, can present like this. Or in some cases, even epilepsy, temporal lobe epilepsy, can present with anxiety symptoms. If the anxiety is severe, the first thing to do is to manage these severe symptoms, providing reassurance that this anxiety is not life-threatening, providing reassurance that anxiety is treatable, providing breathing techniques, de-arousal techniques, relaxation techniques, imaginal relaxation, or even muscular relaxation. Providing psychoeducation that anxiety always reaches the plateau and comes down with adequate exposure to the same anxiety-provoking situation. Now, if the anxiety isn't severe, what we can do at this stage is to go into a diagnostic assessment and ask ourselves, is it an anxiety disorder, a specific anxiety disorder? For example, generalized anxiety disorder, social anxiety disorder, or panic disorder, or agoraphobia. Here, we are asking the patient, what are your symptoms? What are your fears? What do they stop you from doing? How long have you had these symptoms? And what led you to coming in today? For those individuals who've had the severe symptoms and we've provided some relaxation strategies, once those relaxation strategies or the acute crisis has been managed, we can then go into the phase of asking about this specific anxiety disorder. So they come to the same pathway as individuals who didn't have that severe anxiety. Once we get an understanding of their cognitions, their physical symptoms, the avoidance phenomenon, we get an understanding of the kind of anxiety disorder. Here, we can look at specific diagnostic criteria for panic disorder, social anxiety disorder, or generalized anxiety disorder. Now, if they don't fulfill criteria for any of these, consider other diagnoses and appropriate referrals as necessary. If they do fulfill criteria, then we can go on to specific management based on guidelines with regards to the specific anxiety disorder management.